Hello, everyone, and welcome back to our second session of the day on social injustice. In this session, we're going to hear from another panel of three very excellent speakers. We'll kick it off with a talk by Monita Mungo entitled Violence, Virus, and Vitriol, the Tale of COVID-19. Our second presenter will be Jodie Dewey, who in her presentation, The Solution is the Problem, What a Pandemic Can Reveal About Policing. And our third presentation will be by Nazneen Khan, COVID-19 and Reproductive Injustice, the Implications of Birthing Restrictions During a Global Pandemic. So the way this will work is that we will run through each of the presenters in turn, and then when it's over, we will open up the chat for discussion. So if you have any questions, you can type them into the chat then, or feel free to raise your hand and we can enable your voice options. So Monita, if you're with us, and whenever you're ready, the floor is yours.
Thank you. All right. Okay, I hope you can see that. I will be using PowerPoint. I don't like to be stared at while I'm talking. Okay, so like he said, the title of my talk is Violence, Virus, and Vitriol, the Tale of COVID-19. When we hear the term violence, we typically think of a mental framework that includes an interaction of sorts between a perpetrator and a victim that results in some sort of harm. And assigning blame is easy. Therefore, in a perfect world, when you're penalizing the perpetrator, then you are trying to indemnify the victim. And it's a straightforward process, right, in a perfect world. But today, this is not the violence that I am talking about. Today, I am talking about structural violence, which was coined by Johann Galton in 1969. Structural violence and using the omnipresent global pandemic of the coronavirus, I'll explain what structural violence is, as well as give examples and its impact on society. So most of my talk today is coming from chapter 19 of volume 2, which is, of the volumes that basically birthed this conference, and I'm glad to be a part of it. So structural violence is a form of violence that occurs as a result of the normal and regular operating procedures of some social structure and social institution, forgive me, that may harm people by preventing them from meeting their most basic needs. So for you non-sociologists in the room, social structure refers to the organizing ways in which society occurs that makes the behavior that we then perform predictable, right? So for example, the virtual space that we now occupy is governed by pattern behaviors that we've all been socialized to exhibit in academic meetings and talks and conferences, right? So the silence of the audience while I'm talking, the muting of your microphones, the holding of questions into the appropriate time, how you are sitting if your camera is on, how your body language, right? Are you mentally multitasking? Are you feigning interest, right? Whatever your behavior is in this space, I can easily rattle them off because it's an understood social arrangement that we all participate in order to be a part of the social institution we call education, all right? So social structures then empower and privilege some categories of people while disempowering and disadvantaging or constraining others. This creates unequal power relations. And so by continuously sustaining unequal power relations, violence is entrenched in the social structures of society. And as a result, they work to exploit, to marginalize, as well as oppress. Thus, structural violence has no easily identified perpetrator, right? Instead, it's characterized by both a passive phenomenon that occurs as a result of the large social processes that collude to harm people, and then a deliberate action by people in power who will to maintain who wield that power to maintain social stratification. So in the United States, All right, so in the United States, structural violence is a direct result of the maintenance of the social and economic structure of society that preserves the dividing line that separates the weak from the powerful, the poor from the rich, and the inferior from the superior, while at the same time wreaking havoc and harm on those who cannot afford to pay or lack the ability or the opportunity to earn their way up the social mobility ladder. The term violence is used to describe the harm that is preventable as it occurs, right? It's structural because it's embedded in the organization of society. So structural violence then is difficult to see. And when we try to assign blame to one individual, that is also challenging because again, it's embedded in the structural in the way that society is organized, in our policies, in our processes, right? So it's camouflage and all the things that we consider regular operating procedures for being a citizen in our society, right? And so think of things like, practices, policies, safety guidelines, prevention recommendations, right? And so the ways in which structural violence is camouflaged in those regularly occurring everyday circumstances, they distribute power, and based on opportunity and access, those things can be distributed unequally, right? And so as a result, they harm many victims simultaneously, right? And so as a result of the ability to harm citizens simultaneously, then structural violence can be said to be more lethal than physical violence, right? It's important to know that to some degree, structural violence is experienced by all citizens, but it's more noticeable in groups labeled poor and minority, and especially in times of crisis. In addition, structural violence goes unnoticed because its effects are seen as ordinary difficulties that people encounter, such as catching a virus. So last May, when I began working on this, the severity of the novel coronavirus was arguably lost on many citizens in the United States as a result of the divisive political nature. The amount of misinformation and disregard for science rendered the United States exposed. The lived experience that we were watching on television and hearing on the news was ignored while reports continued to broadcast daily from China and Italy, where exponential growth and confirmed cases and deaths had occurred. Because the divisive nature of the political climate in the US has been normalized, it has rendered US citizens an inability to get viable information in order to keep themselves safe. So while there are less polarizing and more scientifically based media outlets, the challenge is determining what sources can be trusted, since the way information in the United States is also politicized. So in this context, instead of being blissful, ignorance can be dangerous with the potential to be deadly. The spread of misinformation is a deliberate action of power wielded by several actors who are to blame for citizens not complying with recommended precautions to safeguard themselves and others. The resulting harm is contagious citizens going about their daily lives and infecting others. The perpetrator of harm is difficult to accuse since there's so many actors involved in the misinformation and the fact distortion, right? And that became a normalized occurrence, right? And so the government officials, the news media shows, the radio shows, the podcasts, all of that contributed to the violence that was perpetuated on American citizens as a result of the political divisive country. And so that result was harm. And the only way, I guess, a logical way to start to quantify what that harm looks like is to count the number of deaths and infections. And so the numbers that are on the slide here are from yesterday, actually, this Tuesday, from Johns Hopkins Coronavirus Resource Center. All right, and those numbers can continue to grow. From the beginning, the federal response from the United States government was one of chaos, confusion, contradiction, and distortion. and it resulted in a lot of consequences, and some were deadly. There were approximately 75 days that passed from when the Center for Disease Control learned about the COVID cases in Wuhan to when former President Trump made his briefing on March 16th, okay? So during that time, there was over 4,600 cases of confirmed infections and over 100 confirmed deaths, according to the World Health Organization. Prevention efforts were hindered because of politics. Adherence to recommended preventive measures, such as hand washing, mask wearing, social distancing, avoiding public gatherings, those had been shown to depend on political party affiliation. A study by Painter and Key showed that political beliefs affected compliance with social distancing orders. An additional study by Fowler and Utic found that Democrats were more likely to comply with recommendations even when it disrupted their lives when compared to Republicans. As a product of human decision, structural violence is preventable as well as correctable through human agency and ingenuity. The federal government has the resources, the access, as well as the opportunity to resolve the myriad problems that were presented by the coronavirus, such as an adequate supply of medical equipment, as an example. Inaction and slow reaction during a time of global uncertainty is a choice with harmful consequences. When the harm, such as death from a virus, occurs, citizens blame weak individual bodies and not the social structure. So think the economy, think politics, that created those unequal conditions or created those harmful conditions, right? So think unavailable testing or inadequate amounts of medical supplies as examples. The established social arrangement compels citizens to blame each other and not the social structure that contributes to their harm, which could have been prevented with a competent and coordinated response to the infectious and deadly virus. So whether through illness, death, loss of a job, income, or any other unnamed but avoidable injury, harm is being inflicted on citizens by this new pathogen. The lack of a coherent and a cohesive federal response is structural violence. As we watch Wuhan shut down on January 23rd, we listened to the former president assure the United States that it was going to have a very good ending, forgive me. At the height of the first wave of the spread of the coronavirus, the former president used language that compared the global pandemic to war. And then consistent with his narrative were statements made at various news briefings and other events that spoke to his wartime president, with the coronavirus being the enemy we were fighting. The problem is, as a wartime president leading the charge against an invisible enemy, he failed to do the most important job of the commander-in-chief, which is to provide soldiers on the front line with the necessary ammunition to be victorious. Instead, he incited chaos and confusion amongst the ranks, rendering essential workers, medical staff, and citizens at large vulnerable to a pathogen wreaking havoc on the world. In addition to the contradictory, inconsistent, and negligent governmental response, former President Trump invoked the coronavirus, he invoked the relationship between racism and structural violence by referring to the coronavirus as the Chinese flu and the Chinese virus. And as a result, racist attacks, both verbally and physically, against Asian Americans increased. Not only does the label stigmatize Chinese Americans as being the cause and carriers of the novel coronavirus, it also invokes a historical stereotype about immigrants and as disease carriers. And as a result, this exposes them to hate, anger, and harassment by other citizens who are fearful and simply prejudiced. Effective leaders communicate messages consistently with their words and with their actions. Inconsistent and contradictory messages create confusion. And in a politically polarized environment, the intention of the messages gets sidelined, and the message itself becomes a smaller battle in the larger war. And in the context of this global pandemic, inconsistency of messages harm citizens, and a politically polarized environment exploits the people to participate in their own mass contamination and murder. So one of the results of this global pandemic has been social inequality. And social inequality is the unequal access to and the distribution of income, wealth, and other socially valued resources. Access and distribution are heavily influenced by race, class, and gender. So thus, you can think of race, class, and gender then as this interrelated axis of social structure that shapes life's choices and chances. So race, class, gender, and structural violence then work together to wreak havoc during crisis. And we all witnessed it, and we are still witnessing the impact of this. So the coronavirus pandemic highlighted the consequences for public health as a result of the political polarization. But again, it also eliminated the numerous problems in the social infrastructure, such as disseminating information and strategies that are racially sensitive. As a preventive measure, the CDC posted instructions for making face masks, right? And so in efforts to keep the medical grade mask going to the medical community, they had an example on how to make a face mask using a bandana, right? The problem with using old t-shirts or bandanas, the model for using it seems very simple, it seems ordinary, but the problem with it is it did not consider the history of racism and how it operates in society. So without the face coverings, Black men have a higher rate of being harassed by business owners, employees, and the police. And, as well as instilling fear in everyone else. So if you add a homemade bandana or a t-shirt type mask, it has the makings of a deadly outcome, especially in communities where policing is aggressive. So the recommendation by the CDC is a passive phenomenon that is used to provide safety measures to protect the general public. But when you add racism to the mix, the safety measures and the public protection collude to add harm to an already dangerous situation. And so that particular recommendation is camouflaged as a public health recommendation, right? But face coverings are potentially harmful for Brown and Black citizens generally, and then Black men specifically, as a result of the racial biases that evoke fear, suspicion, and feelings of imminent danger from seeing a Black or Brown man with a face covering. And you can Google the various videos and news stories that occurred throughout last summer as a result of aggressive policing and public, citizens policing other Black and Brown folks who had on face masks. So wearing a mask while being Brown or Black increases the potential of racial profiling, regardless of the well-known public health guidelines, regardless of the threat to a deadly virus. Race trumped the deadly virus, all right? All right, so another social inequality that was highlighted is the impact of structural violence on our economic system. During times of crisis, inequality will undoubtedly intensify. And so if you think about the preventive measures taken to restrict the spread, so stay at home, social distance, work, work from home. The stay-at-home orders that were mandated by many states were enacted to help slow the spread of the virus. However, this preventive measure did not consider the vast number of citizens who simply cannot comply because of the nature of their work or the fact that multiple generations live in the same home, right? So things like social distancing and isolating or quarantining when someone got sick makes that a challenging endeavor. According to the US Census Bureau of Labor statistics, individuals who are more likely to have the ability to work from home are male, white, and college educated. White Americans are twice as likely as African Americans or Latinx Americans to have the option to work remotely. The latter two groups comprise a number of restaurants, retail, and grocery employees who do not have the option to work from home. So as Dr. Bandy Lee reminds us, structural violence operates through systemic disparities, and it exposes their effects more so on marginalized groups, right? And so again, you add the coronavirus, and these effects are increased. So when you think about how class is affected as a result of the stay-at-home orders, you can look simply to the data, and it's lots of data out there that shows how people who are labeled racialized individuals had a very difficult time adhering to a lot of the safety prevention measures. So while helpful in the short term, the officials' attempts to halt things like housing convictions or evictions, I'm sorry, utility shutoffs, along with the federal stimulus money that has come out, these are just Band-Aids that are attempting to cover the massive bullet wound of the desperate economic impact of the coronavirus. And you have to remember, before the pandemic, so pre-pandemic, these are individuals who are already suffering. And so when you add the pandemic, you are adding to this nature of inequality. Am I at my time? Yeah, okay, sorry. All right, so let me scoot. I'm actually almost finished. All right, so to conclude, the novel coronavirus provides a sociological perspective of the many facets of the global pandemic, as well as examples of the structural violence. Beyond the implications that a new pathogen creates, it's highlighting the social illnesses that already inflict violence on citizens, right? So a slow and uncoordinated federal response heightened the violence, while messages of confusion and contradiction deepened its impact. The harm that citizens have experienced has been simultaneous as well as unequally distributed. In a simple explanation, structural violence is inflicted by the policies, the practices, and the ordinarily daily rituals that we all participate in, and that's mandated by the social structure through social institutions. So it's important that as individuals who participate in these structures, these social structures and social institutions, I don't know why I'm so tongue-tied, it is my hope that we utilize our agency to bring about knowledge as well as change. So by viewing a lot of the harm that citizens experience as violence, then we work to change them politically and economically. So we use our social agency to reduce the harm. Thank you.
Thank you, Monita. I'm sorry to pop on the screen like that, especially because I think your work is so important, and I think the importance of this issue of structural violence that you bring up is something that really undergirds a lot of the research that is going on or should be going on around the pandemic. It's also, I think, an approach that links not just an understanding of pandemic times, but pre-pandemic times and perhaps post-pandemic times. So while it's useful for understanding the pandemic, yes, it's also, I'm going to up it from useful to essential to understanding broader social issues. So thank you very much for your work. We'll turn our attention now to a particular social system that definitely sometimes works and definitely sometimes doesn't work, and that's pandemic policing with Jodie Dewey. So Jodie, if you're ready.
Okay, everyone can hear me okay then? Yep. So my chapter in the presentation I'm going to give today is based on my work as a participant observer at 2 police academies in the state of Illinois in the United States. In the last 6 years, I had the opportunity to experience what new recruits experience by attending lectures, participating in scenario and hand-based training. I was also fortunate in that I was somewhat accepted by the staff and instructors, and therefore I was allowed to attend outside events, formal and informal meetings, and various team building meetings or events. Over time, I was even invited to assist in office duties, review state mandated curriculum, and update some coursework and testing assessments. So I've sort of seen every side of police training in my particular area. And although the arrival of COVID caused the closing of many universities in which these training programs are housed, it also illuminated the enduring issues of policing in a new way for me, especially during a time of global unrest stemming from the killing of George Floyd just months later. What I found was that calling on police in this time transforms a social issue into a criminal justice problem, aggravating a larger global health problem. Further, it reveals that there is not so much a problem in policing as there is of policing. So first, to start off with the pandemic reminds us that there's already existing health disparities. Non-Caucasian ethnic groups are disproportionately more likely to contract, become hospitalized, and die from COVID. In the United States, for example, African Americans are 2.4 times more likely to contract the virus, and compared to Caucasians, Latinos are 4.7 times more likely, and Native American and Alaskan Natives are 5.3% more likely to be hospitalized. In the US, African Americans are 13% of the population and yet are 34% of COVID-related deaths. And specifically in Chicago, the police academies that I was a part of, they were not in Chicago, they were around the Chicago area. So I'm kind of focusing a little bit on Chicago as well. In Chicago, African Americans make up 30% of the population, Latinos 28.8%. And of the African American population, 42%, they make up 42% of COVID-related deaths, whereas Latinos make up 33% of those deaths. One of the hardest hit areas is Little Village in Chicago, a predominantly Latino neighborhood already experiencing disproportionate forms of inequity. We see similar findings abroad, where communities with the highest ethnic concentration and greatest material deprivation also have the highest percentage of confirmed cases of COVID. Health disparities are compounded by inequities in police treatment, where the social determinants of health exacerbate and are exacerbated by inequities in policing. Aggressive tactical policies often used in impoverished communities of color, create and worsen the stress and other health conditions that make one actually more susceptible contracting coronavirus. When it comes specifically to police encounters, Latinos and African Americans are 50% more likely to experience force, 21.4% more likely to experience escalated force, and they are 5 times more likely to endure injuries during encounters with police compared to Caucasians. An example of racialized hyperpolicing was no more evident than in the killing of George Floyd. Not the first man to die in police custody, but his case was a turning point because we all witnessed the grueling, what we thought was 8 minutes and 46 seconds, is sadly now 9 minutes and 29 seconds in which his last breath was slowly expelled, despite the urging by Floyd himself and the many bystanders looking and recording the incident. And it was not the belligerent, vicious scene that one expects from an officer who may feel threatened or fear for their life, reasons often used to justify extreme force. Rather, it was this indifference and mundanity with which this act unfolded that angered us. As someone who studies police training and culture, this scene does not reveal a bad apple, a misinformed officer, a poorly trained officer, a reactive officer, nor an officer who simply defied training. Rather, his actions and the actions of those around him reveals what scares us the most, that what they did is actually how they were trained to handle people like George Floyd. The officer was adhering to the training to which he is socialized into, even if written formalized mandates provided by the state conflict with this. And it was his killing that ignited a groundswell of civil unrest, quickly spreading globally as others stood against police brutality and hostile police treatment. The ensuing mass protests during a global pandemic worsened experiences with police. While police are called to enforce stay-at-home directives and various local ordinances to control the spread of the virus, they often exacerbate policing problems that already exist in communities that are racist-based and hyper-policing practices. Police essentially transformed a health crisis into a criminal justice problem. Anti-racism protests further reveal that rather than developing new tactics in which to approach its citizenry, officers construct community members into the criminals needed to justify current policing tactics. And just like that, the process of policing transforms an act to eliminate widely held social ills into a crime justifying further harm. Because see, in order to be viewed as heroes and protectors, officers must create the denizen into both worthy and unworthy victims and villains. Narrow views of masculinity trap us in a dynamic that requires the denigration and infantilization of the public. When making an arrest is the main objective of policing, then the public must be constructed as arrestable. And protective violence becomes not simply justifiable, but imperative. Therefore, when people take to the streets to protest against police violence, no less, they are not perceived as people who are exercising their rights in need of protection, but they are seen as threats. And oppositional logic tells us then that officers are the targets, justifying militarized and reactive policing where racial and class assumptions to build suspicion supersede any larger health or safety goals. Thus, a militarized criminal justice response to a social crisis intensifies a major health problem as the use of tear gas and OC spray forces people to violate medical and governmental directives to wear a mask. Such chemicals force people to cough, choke, remove their masks, thereby aerosolizing the virus. By rubbing their eyes, sharing water to dilute the impact of the chemical, and being forced into spaces that make social distancing with unknown others impossible, police contribute to the health crisis they were actually called to quell. So when police are called to address a social and health crisis, and in so doing are required to transform the public into the problem to fulfill goals of their occupation, even as they undermine the law and constitutional rights, then police and the act of policing become the biggest threat to the community. So the call for more training or better training that is devised and implemented within the same structure is futile. So what can we learn about the possibility of this moment? The paradox of policing is that it cannot serve the interests of the state and the public. It cannot be considered community policing as it harms them or weaponizes them against each other. A system that must violate laws to serve the public will not survive. With help from the community at every level, we need to critically examine and rewrite the narratives that drive policing, especially those that force officers to convert citizens in need into criminals to be confronted. As Minnesota Attorney General Keith Ellison stated minutes after Derek Chauvin was found guilty of Floyd's murder, it is not justice, but it is accountability, and therefore a step toward justice. But to ensure enduring and sustainable justice, we must cultivate accountability throughout policing. And this begins with training. The question is training accountable to the law, to collaborative values and objectives? To recognize humanity, we must train to humanize, a feat impossible when the goal of policing requires that we do the very opposite. Thank you.
Thank you, Jodie, for that presentation. The work you do, it's really important and it's definitely very timely. I think especially in the US with the recent jury decision, but through all times. So I'm personally really thankful that there are people like you working on these kinds of issues. I think it's exactly what society needs. I keep coming back to these shards of hope, and you're definitely one of them. So thank you for the work that you're doing. I now want to turn our attention to another important issue that I don't think has received the kind of critical attention that it should as of yet, but thanks to the work of our next presenter is starting to, and that's the issue of reproductive justice. So Nazneen, whenever you're ready, the floor is yours.
Thank you, Mike, for organizing this conference and the volumes upon which it's based. Those are two tough acts to follow. But as Michael mentioned, I'm going to be talking about COVID-19 at the intersection of reproductive justice, or rather injustice. In March 2020, after 7 birthing women tested positive for COVID-19 in a New York hospital, healthcare administrators across the nation modified longstanding hospital policies surrounding prenatal care, labor, and delivery. With the safety of obstetric providers and patients in mind, the policy changes included prohibiting laboring individuals from being accompanied by a birth support companion, including their intimate partners and doulas, forcing women to birth alone or without their full support system. You may remember early on in the pandemic stories about women delivering by cesarean section without any sort of birth support. I found this to be disconcerting given the history of reproductive justices in the USA, and was particularly concerned about the implications of these restrictions for Black, Indigenous, and individuals of color for whom birth support provides a layer of protection from obstetric racism. Obstetric racism, a coin termed by Dana Davis, is deeply rooted in settler colonialism, poignantly highlighted in Marion J. Sams's 19th century experimental gynecological surgeries performed on enslaved women by coercion and without consent and without anesthesia. Obstetric abuses continued throughout the mid-20th century, perhaps exemplified in Puerto Rican women's, unbeknownst to them, being used in early clinical trials, testing the efficacy and safety of the birth control pill, some of whom died. And then, of course, fast forward to these recent stories that we've been hearing in California, where dark-skinned Black women, as well as trans men, have been sterilized, also unbeknownst to them, in California state prisons. For women of color in the USA, reproductive justice is an ongoing struggle. Reproductive justice is an intersectional theoretical and methodological framework that was very nicely described in the first presentation and was first mapped out by an alliance of Black women in 1994, including the widely influential scholar and activist Loretta Ross, who's depicted in the lower bottom center of your screen. Reproductive justice is guided by three core values: the right to have a child, the right to not have a child, and the right to safe and dignified parenting. Safe and dignified parenting, a core component of birth justice, necessitates that all women have access to the full spectrum of reproductive services and supports. The RJ framework understands barriers to these services as a violation of human rights. While COVID-19 birthing policies are being implemented to protect healthcare workers and patients, their design undermines safe labor and delivery for birthing women and their neonates by restricting access to vital components of obstetric care. I use the RJ framework to analyze COVID-19 birthing policies because it provides key tools and an analytic lens for exploring the differential impact of COVID-19 reproductive policies on pregnant and birthing women. The RJ framework allows us to consider that pregnant and birthing individuals who have financial and social resources are able to circumvent restrictions by procuring alternative care that is situated outside traditional delivery systems. It also requires understanding and exploring how COVID-19 related policy decisions build upon and advance historically segmented forms of race and class inequality in obstetric care. As Ross and Solinger argue, when politicians, judges, and policymakers make decisions that affect our lives, for example, by enacting or upholding laws that restrict access to various kinds of reproductive health care, they're building on the past. Black, Indigenous, and some groups of Hispanic women have the highest rates of maternal morbidity and mortality in the USA. Their maternal health outcomes are already in crisis. Restrictive COVID-19 birthing policies heighten that crisis by impacting three areas of birth justice. Including birth setting, support, and services. Due to the coronavirus response, demand for out-of-hospital birthing options, such as freestanding birth centers and home births with certified midwives, surged because these non-traditional settings enabled women to circumvent restrictions and also to have their partners and birth supports present. But poor women and women of color have limited access to out-of-hospital birth alternatives for two related reasons. First, in the 1990s, when the natural birth movement garnered greater legitimacy, it increasingly marginalized midwives and doulas of color. The movement also framed birthing choice and birthing rights, such as birth setting and provider options, as a commodity for purchase as opposed to a human right. While this framing was useful for garnering legislative approval, it sidelined groups of women without financial resources. The framing of natural birth in terms of consumer choice also meant that natural birthing was constructed as a luxury commodity for out-of-pocket purchase and not one that should be covered by healthcare insurance. Consequently, poor and low-income women disproportionately women of color often do not have the financial resources to cover the expense of obstetric services that sit outside traditional healthcare delivery systems. Public insurance, which covers nearly half of all US births, is particularly limiting, leaving economically oppressed women with the fewest resources for navigating COVID-19 birthing restrictions. In comparison to private insurance holders, Medicaid beneficiaries are limited to a narrow pool of birth settings and providers. This leaves the most marginalized women to birth in what many pregnant individuals are now calling COVID hospitals. Beyond such restrictions to birth setting, perhaps most devastating to birthing individuals are the restrictions that limit their access to continuous birth support throughout labor and delivery. Birthing individuals and their infants have better outcomes when they have access to continuous birth support. In USA hospitals, continuous care from birth workers in hospitals is highly rare and exceptional. Consequently, the need for continuous, culturally appropriate support is typically met by a partner or family member, and increasingly by a doula. Pandemic-related hospital policies place restrictions on or entirely eliminate women's access to continuous care. In many cases, women are required to choose between their doula or their partner. Doulas improve birth outcomes in hospital settings by minimizing unnecessary medical interventions that place women at greater risk of birthing complications and play an especially vital role in shielding women of color from obstetric racism, decrease the risk of cesarean surgeries and birthing complications, and decrease reported birth trauma. Doulas also serve as witnesses for women of color, often the only birth workers to report incidences of obstetric abuse during labor and delivery. Doulas can also facilitate improved communication between providers and patients, including life-saving language translation. Non-English speaking women often rely upon birth supports with skills as translators, preferably who are also trained in birth support to make informed decisions about their care. Quality prenatal care that is culturally appropriate and that involves positive relationships with providers can offer maternal support, reassurance, practical advice, and reduce the risk of maternal and infant mortality. Particularly for those individuals with higher risk pregnancies, prenatal care can save the lives of mothers and babies. Preeclampsia, eclampsia, gestational diabetes, high blood pressure, they're all potentially life-threatening health conditions that are identified and treated through prenatal care. Despite these known benefits, many practitioners are reducing, modifying, and canceling prenatal services due to risk of disease transmission. In-person maternity tours, birthing and maternal education classes, support groups, and in-person prenatal visits have been canceled, particularly in COVID-19 hotspots. While COVID-19 presents a need for providers to offer alternative delivery approaches, it is important to think through the implications of such alternatives for different groups of pregnant individuals. The loss of prenatal services is particularly disadvantageous for pregnant individuals of color who already face structural barriers to accessing and persisting with prenatal care. Rural women, women of color, Medicaid beneficiaries, women who do not speak English are particularly prone to disruptions in prenatal care because they overwhelmingly experience subpar prenatal care, culturally irrelevant prenatal care, and obstetric racism or disrespectful care. Further disruptions to prenatal care due to COVID-19 puts these groups of women and their fetuses at particular disadvantage, especially for women in their third trimester. In addition to reducing prenatal visits, many practices are digitizing their prenatal care through telehealth visits. Telehealth visits can be particularly beneficial for some women, but for others who do not have access to electronic devices, who go without reliant high-speed internet, or whose insurance doesn't cover the equipment needed to self-monitor their care at home, do not benefit necessarily from telemedicine services for prenatal care. Many women report interruptions to prenatal care. Hospital restrictions are the most stringent, with a host of media stories detailing the experience of COVID-19 positive women who are forced to have inductions or cesareans, of birthing by cesarean alone, and or being separated from their newborn infants. This practice of separation persists despite the recommendation of the World Health Organization to keep COVID-19 positive mothers and infants in close contact. And despite that separation may not prevent infection and disrupts both newborn physiology and immune protection via breastfeeding. Some hospitals are separating mothers and newborns until COVID-19 tests return with negative results, also against WHO recommendations. In conclusion, pandemic policies that restrict birth support persons and birth services undermine reproductive justice and are particularly harmful to publicly insured women, women of color, and economically oppressed groups of women who have the fewest options for quality obstetric care, leaving them at higher risk of birth trauma, disease transmission, obstetric violence, stillbirth, and even death. A pandemic is not the time to strip birthing rights from pregnant individuals. It is a time to intensify our efforts to ensure that reproductive justice is being achieved safely and intentionally. So these are just some references and further reading, and of course my references are in the COVID-19 Volume 2 chapter.
Great, thank you so much, Nazneen. You know, as I said when I was introducing your talk, I think that this kind of work is not getting the attention that it needs, that it deserves. And that's why the kind of work you're doing is so important. And I think this nice bridge between activism and scholarship that we definitely need a lot more of, especially now.
Yeah, thank you, Michael.
I want to open this up now to the audience. I think I have enabled the chat. So if folks have questions, they can go ahead and type it into the chat or raise your hands and we'll be able to call on you. And while folks are thinking about that and typing some of their questions in, I have one for all of the presenters today. So all of your talk spoke to this critical issue of structural violence. And as Monita pointed out in the opening presentation of the session, this is a type of violence that's often camouflaged. It's something that we just come to assume, and it's seen as that word sociologists don't like, as natural. So what do you think that we can do to help remove that camouflage, to help shed light so that these issues move from being assumed to being problematic? Obviously, they are problematic issues, and we see them as problematic issues, but so that maybe the general public, the politicians, the voters, let's say, also see them as problematic. And I'm gonna start your answers for you and say that my answer will be your own work, because I think that's an important first step, is the kind of research that you're doing and getting that out there. But in addition to that, what do you think could be done?
I'll go first. I think part of the reason is that people are salient, right? It's easier to see the people as being cause of some of the issues as opposed to looking at the policies and the processes. And so I think by calling out, right, so obviously making everyone take an intro to sociology class, right? But then making sure that we call out the processes and the policies, like being very, like, call it out. I was at a protest and, you know, people were kind of lightly talking over some of the things because there were, you know, administrators in the room, and I understood why. So when someone answered, well, I don't know, I yelled out what the direct policy was, because in order for us to make changes, we have to name it. We have to put a face on it, right? Because again, you know, from a social psychologist standpoint, we see people, but it's hard to see the policy that the people are enacting. And so in order to make any types of change and to highlight the structural violence that's causing this harm, we have to unmask it, uncamouflage it, right? Make it visible.
I think building off that idea, I think the bigger problem for policing is transparency, right? And so when the people don't have access to those policies, right, they don't even have the ability to engage in conversations because the structure is so so difficult to penetrate. And when we have cases like the Derek Chauvin case, that, you know, we're all commending these officers for coming up and saying, hey, this isn't how we're trained, what he did was not right. It's great for the short term, right? It's a win. But for the long term, it doesn't indict the system, it indicts the person. And so when we don't indict the system, right, then we protect that system. And so that's the problem I'm having right now when I'm engaged in conversations with various chiefs of police, is that we don't need your training. We have state mandated training. We have this training. Okay, then let me see the syllabi. Let me talk to the instructor. What is their background? Oh no, we don't need to give you that. And so if I can't get that information, how is the average person going to get that information to engage in the conversations that Dr. Mungo is indicating is very important?
Yeah, and I will just add to that, Dr. Mungo mentioned being at a protest. I think that it's vitally important for academics who are doing work on inequality to also create liaisons and be really involved in their communities. Reproductive justice is defined as a struggle. The verdict yesterday came about because of activist struggle. So being very involved in our communities is also vitally essential, and helping our students also figure out how to be a part of community justice work and community justice organizations, I think is also vital.
Yeah, those are all excellent, inspiring answers. I'm going to clip this and show it to my students at the beginning of every semester when I'm forcing them to take Intro to Sociology. I think great responses, very thoughtful. I really like that. Something that comes to my own mind is it's a little concept I try to throw into all of my classes about the idea of a metonym. And a metonym is basically a word that you use to describe something else. So when we talk about the White House announced something today, or the Crown did this or that, and then people want to blame the White House, but that's a building, right, made of limestone or concrete or whatever it's made of. It wasn't the White House didn't say anything. It didn't decide anything. There were individuals there that made those decisions, right? Nike doesn't do anything. The US doesn't decide, it doesn't declare war. It's a couple of people not too far from the White House doing that. So I agree with all of those answers, and something I always try to instill as well, that we have to unmask this. We have to identify what the problem is and stop using camouflage to camouflage, I think. So great answers. We have a question here in the chat here from Sarah. Sarah says, thank you for the fascinating talks. Monita, could you talk further about the discourses of intersectionality in the pandemic? It is a very useful analytical framework to use for exploring structural violence. Good question.
Okay, I'm not sure what is meant by discourses of intersectionality, so I'm going to use a trick a lawyer taught me. So I think you're asking the ways in which intersectionality can be used to talk about the impact of the pandemic on the various, life, the ways in which we experience our society is impacted by the pandemic. So intersectionality, if you think about, Sarah, the roles you play, right? Whether you are a partner, whether you are an educator, an academic, all of the various social roles in which you play, you don't walk through our society as one person, right? And so the various different social roles that not even just social roles, just roles that you operate in society, right? Those all combine to help you experience life, or in this case, the pandemic, right? So I'll use myself as an example. I am a wife, I am a mother, I am a professor, I am an aunt, so I have all of these roles, right? These titles. but how I got to experience the various impacts of the pandemic is I'm also a Black woman, right? And so I don't experience life as just a woman. I experience life as a Black woman. I experience life as a Black faculty, female woman, right? So all of those ways in which my roles intersect, right? I can experience the pandemic. Can you answer? Can you unmute your mic? Do you mind, Michael?
Yes. So Mike,
Okay.
can you hear me? Yes. So that's exactly what I was looking for.
Okay.
So just
Okay.
to explain the intersecting elements or identity factors and how they all work together. So often we see, one identity factor being highlighted and that takes precedence, but sometimes people fail to understand the complexities of all the different identity aspects, interwoven, overlapping. So yes, thanks for explaining that.
Okay, you're welcome.
Yeah, I think that issue of intersectionality is key to understanding most of the issues in the pandemic. Sometimes it's hard when we're looking at numbers, and even when they break the numbers down to men and women have different rates, or different people of different races, or people in different states, we forget that those aren't just men and women, right? There are Black men and white men and Latinx men in there, and there are gay men in there, and poor men and rich men, and those are all important to analyze rather than just sort of lump them together. So this idea of intersectionality, I think, is also critical. And again, an issue not just to understand the pandemic, but to understand society, to understand how the impacts of the pandemic are able to be impacts relies on some sort of pre-existing structure. So great question, great answer. Let me pitch out another question for the three of you. If you think that there's, and this is one I've been trying to ask in every session because I'm trying to hold on to these little bits of hope. Do you think that there is the possibility for some deeper change in the future? Something that's going to last more than just 2 or 3 years, or more than when we stop talking about COVID, if that happens, I hope that happens. Something perhaps more deeper and fundamental that we might be able to pull out of this.
Well, I think I'll go ahead. Go ahead. Nancy, go ahead.
No, I'm sorry. No, go ahead. I was just joking. I was just saying, like, no, I'm always a bad person to ask about like the glimmers of hope because I'm a trained sociologist and we see I'm a critical sociologist, but I do think that our institutions, I have seen some interesting things, particularly coming out of education systems. Although I have my critiques, there have been some really positive things that I've seen play out, such as school lunches being provided free to every child because they know that kids, and in my particular district, we're seeing buses bringing food to kids who are doing online learning, and just so many new strategies and ways of promoting inclusion that I have never seen before in our society. So I do think that there are positive elements to both, thinking about reproductive justice, raising children, and thinking about expanding healthcare. So I didn't talk about some of the positive things that have occurred since the pandemic, but a lot of states are expanding Medicaid coverage now to cover doulas and other kinds of supports because of the pandemic. So I do think that there are things that our society is rethinking, or that our social institutions are rethinking in ways that will be long lasting.
I think building on that, I think you made an excellent point. Not just that as sociologists, we're all pessimistic, because I'm there with you, but education is important. And why, for example, in police academies and in police training, why is there not some sort of oversight from people who are trained in education, people who are trained in anti-racist and anti-sexist pedagogy? I find no consistency in the training of police officers. So in the state of Illinois, we have state mandates, and they come to us in bullet points. And so it's up to each individual training academy to decide who is going to teach those courses, what background they'll have. And sometimes that's somebody who has studied extensively in an area of policing. And other times it's just, Joe doesn't feel like working the night shift anymore. He wants to work 9 to 5. And so this is a great gig for him. And so that's not the way that educational institutions operate. And there needs to be more oversight from educators, in my opinion. But we can't do that until we build that bridge and we get into policing, because the more attention you put on policing, they close their doors even harder. And so as soon as Biden became president, all of a sudden, you know, we have a lot more Democrats and liberals have a lot more power, and boom, everything shuts down. And so it's becoming more difficult to get into policing as these cases of Black men, unarmed Black men being killed, come forward, unfortunately.
I will only add, of course, as a sociologist, my initial answer was no too. That's why I didn't say anything. And you know, but then when I put my rose-colored glasses on, it's like, okay, if we continually unmask all the things, right? Because we clearly have learned some things. We've learned that the internet, right? Access to the internet needs to be considered a utility just like water and electricity at this point, right? We've learned that. So we've learned, like Dr. Dewey said that, or no, Dr. Khan, one of you said that, you know, not having face-to-face classes impacts more than just learning. It impacts, you know, students' ability to have two of the meals, two consistent meals, right? And so we've learned all those things. And so a reimagining then of how we go about addressing things like food insecurity, learning, things like, you know, like she said, policing. We have to continue. We have to not get complacent, right? As things start opening up, as people get vaccinated, we have to fight the not going back to normal, but reimagining what the new normal is, because a lot has been exposed. And so we need to keep that exposure front and center so that we don't go back, because you can see it. We're slowly trying to get back there, and we don't need to. We learned a lot of good things. So I think, you know, with my rose-colored glasses on, we can do good, fix it, be better. I don't know. But my sociologist glasses says no.
Yeah, I've been making the joke for days. I like to make it all the time that as a sociologist, I just can't be optimistic. But my husband told me last night that I was overusing the joke. I needed to come up with something new. So thank you guys for making sure that got inserted there. But I feel the same. You know, it's difficult to be optimistic. I want to be. It feels like I know better, but I don't want to know better. It's one of those moments, I think, when I hope I'm wrong. I really hope I'm wrong. I hope that we're all wrong, at least about the potential of it getting better. I'm afraid we're probably not, but I hope that we are. So I just, you know, Adam posted something in the chat here, and I just want to read. I think it's a great way to wrap it up. He said, this is why Neil deGrasse Tyson said that when humans enter the equation, things go nonlinear. And this is why physics is easy and sociology is hard. So on that note, thanks to all of you, for the presenters for sharing your work with us, to the audience for joining us. We're a little over time on the session, so we're going to wrap it up here. And in about 10 or 12 minutes, we'll come back with our next session on changing understandings of the social order. And please also stay tuned then for our keynote address after that with Dr. Sari Hanafi, the current president of the International Sociological Association, talking about the potential futures of sociology in a post-COVID-19 world, which will be quite interesting. So thanks again to our presenters and everyone for joining us, and I hope to see you at our next session in about 10 minutes.
Thank you.